Okay, so again, hello to Mechthild, Roos, and over to you for your presentation.
Thanks so much. Many thanks for having me on this really nice talk series. I really enjoyed the previous talks. I really like the setting of this talk series, so I'm really excited to be part of it. As Mary already said, I'm going to present a part of a current research project on the construed role of the EU in national policy making on asylum seekers and refugees' access to healthcare in different member states. This is part of a larger research project in which I study this political regulation and the politicization of asylum seekers and refugees' access to healthcare in different EU member states. And in this project for now, I focus on Germany and Sweden, but I'm going to tell you more about that later. So what I want to talk about today, very briefly, is I want to outline the research object at the basis of this. Well, I guess it's going to be a paper, maybe a bit more at some point. I want to walk you through the data that I'm using for my empirical analysis, and then I want to present you with first findings from the analysis. So maybe starting with the research object, the somewhat bulky research question underlying the paper is how did governmental actors use references to the EU as justification for recent changes in the political regulation of asylum seekers and refugees' access to healthcare in Germany and Sweden? Now, if we break this up into a little more digestible elements, we have, first of all, asylum seekers and refugees as target group. I refer to these two groups because I want to make clear in my analysis that it addresses persons both before and after the determination of their legal status. After all, the analyzed policies that I'm looking at are applying to persons from both of these groups because the conditions of applicability are determined not only by a person's administrative status, but equally by the length of their stay in the respective host country. And in the context of this study or of this research project in general, it's important to keep in mind that asylum seekers and refugees are third country residents, so non-citizens of the host state who have not or not yet contributed to the respective national security system, but who nonetheless have healthcare needs beyond emergency care, which makes them, of course, a somewhat challenging target group for national legislators and, of course, a very interesting group from a researcher's perspective. I focus specifically on this target group's access to health care as an important aspect of their mid to long-term integration into host country societies, or alternatively of political endeavours to keep them at the margins of one's society. Healthcare here has an important bridge function in that health is, of course, a precondition for a person's integration into a society and also, for instance, into a labour market. Health also has a strong symbolic dimension in that healthcare regimes create insiders and outsiders, not least, of course, based on the criterion of deservingness and of responsibilities a state takes towards its residents and its citizens. And this can differ, of course, a lot, as this research shows. So when studying the access of asylum seekers and refugees to health care, this really works as kind of a lens through which a state's approach to and treatment of these groups of people can be studied. In this sub-project, in this paper specifically, I look at the justification of policy changes in the area of asylum seekers and refugees' access to health care, which means that I examine political intentions rather than the actual implementation, so kind of the way leading up to the legislation rather than the legislation itself. And this focus helps understand how politicized this regulation in the end can become, both on and under the surface, particularly in a context of crisis, which I will explain later. For this paper specifically, I look at the discursive behavior of governmental actors, given that policy initiatives which trigger policy change typically come, of course, from a state's executive, i.e. in this case, from its government. I focus specifically here on government's references to the EU. These EU references, in my opinion, constitute an interesting case study because although the legal regulation of asylum seekers and refugees' incorporation in national healthcare systems remains largely a national competence, both the areas of health and asylum policy have experienced increasing, if still fragmented, integration at the European Union level. And these integration processes have not only forced national legislators to adopt policies and laws in order to abide to EU standards and laws, they have also provided national governments with ample opportunity to shift the responsibility for policy reforms to the EU, even in cases where such reforms would not have strictly been required based on EU legislation. And what is certainly clear from the kind of gradual restriction of asylum seekers and refugees' access to healthcare in both the states that I'm looking at is that while Article 35 of the EU Charter of Fundamental Rights provides for a fundamental right to healthcare, this right is so vaguely defined that it leaves the member states and their governments with much space for interpretation, especially when it comes to groups of persons at or possibly even beyond the margins of society, such as, for instance, asylum seekers and refugees. For now, I compare the instrumental usage of references to the EU in related policy makings by the governments of Germany and Sweden. These are two countries which stood at the forefront of the recent so-called migration or migration management crisis, in that both countries initially opened their borders, took in a lot more asylum seekers per capita than other EU member states, presented themselves as kind of moral superpowers within the EU. But after a short period of demonstrative openness, both countries changed their stance towards refugees and asylum seekers, mostly under the impression of growing public anxiety vis-à-vis those coming in seeking shelter in Europe. And these similar reactions are particularly remarkable when we consider the fundamental differences, both politically and systemically, when it comes to both countries' incorporation and health regimes. So we must assume that the similar political reactions to the so-called crisis cannot be explained, or at least not solely explained, through the policy regimes and the kind of political traditions. So this is why I seek explanations elsewhere, for instance, in this paper, in the way governments justify the policy changes that they undertake. So for the research objective and the kind of context in which this research takes place, the data I'm using consists of policy documents, different kinds of policy documents, a growing collection, so I cannot put a number on it yet, but it will probably be something around, I don't know, 100, 150 documents in the end. This consists mostly of draft bills and explanations by governments and individual ministries, of government declarations and decisions which are non-binding, but give insights into the thoughts and ideas behind the draft bills. I look at output by ministries and also by responsible state agencies, because both in Sweden and Germany we have state agencies with significant influence on bills and on legislation more generally through the government. I look at government press releases and information material which is addressed to the public and in which you of course find a lot of justifying language. And finally, I look at speeches by members of government in parliament and at answers to parliamentary questions in which governments justify their action vis-à-vis parliamentarians, but of course in a larger sense also vis-à-vis voters and the public more generally. Now, when we come to the analysis, before I present you with first indicative findings, I want to quickly speak about the conceptual framework that I'm using for this analysis. So in my analysis, I start from the assumption that in an emotionally and normatively charged context, such as the recent so-called migration crisis, processes of justification and of responsibilization, which we talked about in the last talk, it's very interesting. These processes play a particularly significant role in policymaking in such a charged area again. And to trace such processes behind Germany's and Sweden's references to the EU, my analysis draws on the two concepts you see here, namely framing, which I define with Sainsbury, which helps understand actors' problem construction and justification of political action, and framing establishes who should have jurisdiction over an issue and formulate solutions. Framing and the politics of justification can influence the scope of support for policies, mobilizing both backers and opponents, and thus have an impact on alliance building and policy coalitions. So again, that's Sainsbury. And so framing can thus be considered a crucial element in government's pursuit of their legislative success. And I couple this concept of framing with Rudin's concept of claims, which says that a claim exists when a political actor makes a statement that suggests some aspect of policy is to be changed. Each claim can be positive or negative, its tone, and use a certain justification, its frame. And I define with Rudin in a slightly extended definition that target groups of policies and also target entities of policy actors' claims do not simply exist in legal terms, but they are constructed, questioned, and maintained within political debates in general and claims-making processes in particular. So this I kind of is the frame I put on EU references. And then I analyze these references and how they're used, how they're instrumentalized, and with what purpose they are applied. So now coming to the first findings, the roles that I kind of coded in the documents and the policy documents that I analyzed are roughly these that I found so far. It might be more in the course of the research project. I will walk you through them bit by bit, and I brought you a quote for which illustrates each role attributed to the EU and the idea behind it in the draft bills, in the kind of legislative initiatives that the governments pursued following the 2015 so-called migration crisis. So first, the EU is repeatedly depicted as a regulator. I brought you here a quote from a draft bill from the German government adapting the German social welfare law for asylum seekers, the Asylbewerberleistungsgesetz for the German speakers among us. And here the German government argues, amongst others, on the restriction also of asylum seekers and refugees' access to healthcare. So this is a crucial element of this. The German government says this directive, a certain directive, EU Directive 2013-33, provides the national legislature with a certain degree of freedom in determining an appropriate standard of living for asylum seekers, and it expressly allows the legislator to assess the designated benefits differently from the benefits for its own citizens, provided that the standard of living granted to its own citizens exceeds the standards provided by the directive. So basically, what the German government is using the EU for here is that it justifies treating asylum seekers worse than their own citizens with an EU directive, and kind of arguing this EU directive expressly allows us to kind of apply two standards of living to these two groups of persons. So again, here the EU is used, the EU reference applies to the EU as regulator. And allowing and inviting kind of national regulation in the way that it is taking place by the government. Secondly, the EU is used as kind of a scapegoat to make national policies more restrictive than they previously were. I have a quote here from a statement by the Swedish Prime Minister's office on the website from 2015, in which the Prime Minister's office says, the government therefore wants to temporarily adjust the asylum regulations to the minimum level in the EU so that more people choose to seek asylum in other EU countries. This is a narrative or kind of a claim that appears over and over and over again in Swedish documents. The EU standard in healthcare access is so low that we have to adjust to that low level in order to cope with the situation, in order to make people look for asylum elsewhere because we are overwhelmed with the situation. So you have this a lot, this kind of claim. The EU is also referred to as a non-regulator in the sense of that it's not sufficiently regulating where it should regulate asylum seekers and refugees' access to healthcare, or more generally to social benefits and social security systems. And here I again have a quote from the Swedish government. It's a government decision on the Sweden's future migration policy, in which the government says, as regards time-limited permits, the length of the permit periods is of crucial importance for both society and for the asylum seekers. Also in this part, it cannot be expected that the revision of the European asylum system will result in a complete harmonization of member state policies. So pretty much connecting to the scapegoat role, the Swedish government says here the EU will not sufficiently regulate this, so we have to go down in our standards because the EU will not increase standards EU-wide to a level that we could rely on it. We have to go down ourselves. There are examples also, although they are much more rare, in which the EU is, to the contrary, used as kind of a standard setter, but more with a look to the future, not so much with regard to what's happening right now. So the German Minister of the Interior, Thomas de Maizière, said to the German Parliament in a plenary debate in 2015, I am convinced we need a uniform EU asylum law, including in terms of procedures and benefit standards. This is a debate on healthcare access for asylum seekers and refugees. Europe may at the moment be part of the problem, but only Europe can be part of the solution. So he's arguing Europe has to become a standard setter here, otherwise we cannot solve this problem that we have. Both the Swedish and the German government also refer to kind of a vaguely defined to the other EU member states without naming any in particular, just kind of distancing themselves from the rest of the EU member states. For example, again here, a Swedish case in which the Swedish government says the Swedish regulations should be sustainable in the long term and not significantly deviate from other EU countries. So basically an EU member state reference saying we have to, again, bring standards to one level so that not a few countries are the main host countries and the others are not sharing any of the burden. That's kind of perception that you have. And finally, in both countries, you have a reference pretty much to their own country as model country within the EU. So here's a very, very, it's a rather dramatic quote from a member of the German governing party, CDU, Thomas Strobel, who says, if Germany admits defeat in this humanitarian emergency, every other country in Europe must do the same. If Germany gave up, what would the other countries in Europe be able to do? What can we expect from other countries in Europe if we expect nothing from ourselves? And again, this is part of a debate on regulating and, ironically, on restricting asylum seekers and refugees' access to health care, in which Strobel is basically arguing we have to show the EU how a feasible solution can look. So we have to, since we deal with so many people, we have to restrict their access to kind of cope with the situation. And if we give the EU an example of how to make it practically work to take in such large amounts of people, then the EU will follow our example and will kind of do what Germany is doing. So again, these just some brief insights into the documents and into the roles attributed to the EU within them and how they are meant. And now maybe as to finish off, some very first comparative findings when we put Germany and Sweden next to each other in their references to the EU in legislative proceedings. Then one first finding I had is that the Swedish government is significantly more outspoken than the German one in its justification rhetoric, even though what it does justify, so kind of the restrictive measures that it justifies are comparable. Indeed, they are to large extents quite the same. So both countries significantly restrict asylum seekers and refugees' access to healthcare. They both do it first on a temporary basis. So they say this law only applies for a number of years and will be revised at the end of them. But both countries have extended the restrictions that they in 2015 adopted. So it's really a very similar answers to the situation in the area of healthcare access. And these more strongly worded references by the Swedish government and this more strongly worded justification rhetoric by the Swedish government includes its references to the EU, for instance. As the quotes before showed, the Swedish government emphasizes repeatedly the high Swedish standards and the low EU standards in refugee support and in refugee rights and claims. And the government repeatedly points out that Sweden must abandon its superior position so as not to drown in numbers of incoming refugees. So this is really, again, a very strongly worded, very, very sharp rhetoric that the government applies. And this different tone in justification can maybe to some extent be explained with a view on the two countries' different incorporation systems and incorporation regimes, because the Swedish government in a way needs to present a stronger or a more outspoken argumentation, given that in comparison to Germany, it faces more explanatory or justification pressure, given that Sweden has a tradition of openness vis-à-vis refugees, vis-à-vis asylum seekers. Germany, on the other hand, only begun to understand itself as an immigration country recently in the early 2000s, basically. And also Germany has already an established tradition of restricting rights and claims of refugees when the situation gets uncomfortable. We had exactly the same dynamics in the 1990s when numbers of incoming refugees increased significantly in the wake of the Yugoslav war. So it was rather similar there. And so the government in Germany faces a lot less public pressure in a way to justify restrictive measures than the Swedish one does. Secondly, I found that both countries, in their self-declared role as moral superpower within the EU, they instrumentalize this role in a different way. Let's say it this way. They use their role as moral superpower in kind of different directions. So I found that the Swedish government refers mostly to its past role as model of high standards within the EU. So it says in a way that Sweden's established openness vis-à-vis refugees has contributed to the current crisis situation. So this situation needs to be changed, which means abandoning to some extent this very role of being a model within the EU. In Germany, on the other hand, the government tends to refer rather to its role as model in the EU with an eye on necessary or desirable future developments, in the sense we have to show other member states, we have to show the EU more generally how you can take in so many asylum seekers and still make the situation work for everyone, for politics, for the society, for those coming into the country, so that the EU will eventually adopt the German model example, which will then, if everyone kind of shares the burden, allow for a gradual lifting of standards. And this approach, of course, this argumentation goes very well with the German very strong understanding of subsidiarity, especially also in the area of healthcare, i.e. of dealing with an issue at the respectively most immediate level, of only transferring crisis management or generally care work, etc., to the next level if it cannot be solved further below. So which is of course a state Germany has reached with the so-called migration crisis. It feels it cannot deal with this on its own anymore, so it has to restrict its measures, its claims, the rights for those coming in, and only if crisis management and crisis solutions are taken to the EU level can standards be lifted again, and can harmonization contribute to a better situation for everyone. And finally, the final indicative finding that I had is that references to the EU in the regulation of healthcare access, and also this regulation in itself, are shaped in both countries to a significant extent, on the one hand by party or coalition politics. So if we look at Germany, we have three parties, the Christian Democrats, the Christian Socialists, and the Social Democrats, which have extremely different positions on asylum seekers and refugees' access to healthcare. Very, very different incorporation policies more generally. So the Social Democrats are much more migration friendly than the two other parties, particularly the CSU, the Christian Socialists. They are really, really critical to that end. And so the result is that rhetoric is shaped by compromises between these parties. So they are not as strongly worded as they might be if parties would be more in line. On the other hand, these parties have a very comfortable majority in parliament, so they can afford to have kind of vaguely worded policies. They will get their votes if they need them. And it's actually quite interesting that in the Social Democrat Party, we have a significant number of rather outspoken defectors in votes on the related government bills who take position against their own party, against the government that their party is forming. And the government can afford this in a way, so it doesn't need to justify as much what it is doing, since it can rely on this big majority. We have the absolute contrary situation in Sweden, where we have a minority government throughout the entire time under consideration, with the Social Democrats and the Green Party significantly relying on support by the Liberals and the Centre Party, and both of them are further right on the political scale. And this means, of course, that this pressure, in combination with strongly perceived pressure also of vote shift towards the far-right Sweden Democrats, this induces the government, this minority government, much more to justify what they are doing with a clear tendency towards the political right, because this is where they need to get additional votes from in parliament. And this calls, of course, also includes more restrictive incorporation regime, less EU interference in national core policy areas such as welfare and healthcare. And this you really find, I think, in the policy documents that I'm analyzing. And next to these party or coalition politics, I find that the respective traditions of dominant perspectives on European integration play a role in both governments' EU references in this area. So in Germany, you have a much stronger normative dimension of the EU as kind of a forum where issues of transnational dimensions can be solved, where you have a general openness towards ever closer union in different areas, including in the area of healthcare policy. So kind of you have less, in general, traditionally you have less EU blaming in politics than you do have in Sweden, where you have a more rationalist, a more utilitarian approach to the EU, which is seen first and foremost as a single market. But there is significant skepticism as regards EU interference in, for example, such national core areas as welfare and healthcare. Yeah, maybe to this point, I keep it at that. Again, these are just very first findings, which need to be corroborated by further empirical evidence. And I'd be really glad for any feedback, any thoughts you might have. Thanks a lot, and I'm looking forward to the discussion.
Okay, thank you very much, Mechthild. I'll just stop the recorder.